According to the CDC, cancer is the second leading cause of death. The fight against cancer is a long, tedious, and emotional experience in which support is essential for the patient's success. An organization named the American Cancer Society aims to help facilitate the fight against cancer in American patients. The American Cancer Society is a nationwide, community-based, voluntary health organization. Its mission is to eliminate cancer as a major health problem by preventing cancer, saving lives, and diminishing suffering. It focuses on patient support through programs that assist patients and their families ease the burden of cancer. It also conducts and funds extensive cancer research on how it could be prevented, the causes, ways to detect it early, treatments, how to improve quality of life, and how to advocate for laws and policies that help further cancer research. ACS helps prevent cancer by disseminating information to health professionals about cancer prevention and how to reduce the risk of cancer development. While the American Cancer Society has origins in New York City, the headquarters are now located in Atlanta, near the CDC headquarters. John Seffrin serves as CEO, Otis Brawley as Chief Medical Officer, and Cynthia LeBlanc as Chair. Started in 1913, the organization was born in a time in which the word cancer was not appropriate to be spoken in public. 15 physicians and business people sought to increase public awareness, making the dangers, care, and prevention known to the general public. Today, the motto of ACS is to save lives by helping people stay well, helping people get well, by finding cures and fighting back. The ACS currently publishes 3 journals, one directed towards the general population dealing with cancer, another towards medical professionals, and one specializing in data and articles catered for medical researchers. These are titled Cancer, a Cancer Journal for Clinicians, and Cancer Cytopathology. Some of the recent changes ACS has implemented include the change of its fiscal year reporting date from August 31st to December 31st, and a nationwide reorganization in which the organization centralized its operations and consolidated, merging previous regional affiliates into the parent organization. The ACS has recently been ranked among the top 10 most popular charity organizations in America and has coverage throughout the United States, utilizing more than 900 offices. The nearest office to UTPA is actually on McCall Road in McAllen. ACS discloses financial statements annually through an audit conducted by Ernst & Young. In 2013, ACS spent $681 million on mission program services including patient support, research, prevention, and detection and treatment. An additional $255 million were spent on support services including fundraising and management. All these expenses are primarily funded by support from the public, generating $884 million in 2013. The 2 greatest fundraising events the ACS hosts are the Relay for Life and Making Strides Against Breast Cancer, generating $497 million. An additional $86 million were generated by investments and grants. ACS uses a fully diversified asset allocation investment strategy with intermediate and long-term horizons, with the primary goal of providing modest asset growth while protecting principal and preserving the real purchasing power of the investments. Some of the strengths associated with the American Cancer Society include the diverse network used for disseminating information, the organization's widespread name recognition via a strong marketing and fundraising strategy, and the knowledgeable and experienced many volunteer physicians, businessmen, and regular civilians that continue to make the organization a success. Weaknesses of ACS include the dependency on volunteers for the success of the organization and the challenges that nonprofits face in order to keep their tax advantage classification. Some of the opportunities of ACS primarily include the ever-growing impact of cancer on mortality because more people are dying of cancer today than ever before. Furthermore, because it has been shown that social support is essential in the battle against cancer, the ACS will have an increased demand. Threats the American Cancer Society face include market volatility. This is due to the fact that investments significantly contribute to their overall income. Furthermore, unfavorable government legislation and unfavorable media coverage are also threats for ACS's success. In summary, the American Cancer Society is a large, nonprofit organization focused on improving the lives of cancer patients and improving medical care related to cancer. It obtains revenue primarily from donations, fundraisers, and investment income. Because of its widespread national coverage, it is able to penetrate many parts of the country in which it can provide support for cancer patients residing in the same communities that help the organization fundraise for cancer support.